Welcome to Gate City Insider. I'm Rosemary. We are beginning year 3 of dealing with the COVID pandemic. And in Greensboro and Guilford County, it has never been at its highest than it is right now in January of 2022. We're talking today with Dr. Cynthia Snider, who is Cone Health's Medical Director for Infection Prevention. Thank you for being with us today.
All right. Thank you, Rosemary. It's my pleasure.
So we are recording this mid-January, and I think that's important to say because at this point, we have been dealing with COVID almost 2 years. I mean, we'd kind of, at this point, 2 years ago, had just kind of heard about it. And so for the purposes of this recording, I want to make sure that people understand that this is where we are right now. And so from your perspective, Dr. Snider, where are we right now? What is the latest on what we know about how this disease or this virus is spread and how it is treated?
So right now we are in the thick of the Omicron wave of the COVID pandemic. And here locally, we probably have been feeling that, all the pressure from all the cases in the last 2 weeks. We still anticipate over the next, 4 to 5 weeks to still be in the thick of it. And our numbers suggest that in the next week or so, we will finally hit the peak of this. But it's incredible. We have had an amazing amount of stress in healthcare system because of all the cases of COVID in the community. And it's almost a little bit of a perfect storm. I think a lot of us were looking forward to resuming some normalcy to our lives and celebrating the holidays with our families. But that's exactly when it started brewing in our community. And this variant is so much more contagious than the Delta variant or the original strain. And so not only are more people getting infected from one person, it shows up a little bit quicker. So that incubation period is shorter. And then on top of that is that there is not enough access to testing in the community. And so when you get tested, the turnaround time is really long. So it almost, you're looking at old data, if that makes any sense, or the one person's waiting for your test, but it's been like 7 days and 10 days, and already another generation of people possibly have had it from you.
Okay, so that's kind of a lot to digest. So let's take it apart a little bit. So let's talk first about transmission, because you said this Omicron variant is so much easier, or the transmission rate is higher, and it seems to spread so much more easily. Do we know why? And do we know what things are really successful at preventing transmission?
Yeah, so this strain, this variant has about 70 times more replication in the upper airways. So I think that concentration up here, it makes it easier to transmit onto others. And so we think about like one person in the past would give it to 3 or 4 people, but now it's like one person can give it easily to 5 to 7 people. Mm-hmm. And what we're noticing is that that in the past, the incubation period we thought was 5 to 7 days or 5 to 9 days. Now it seems that some people are showing up to having symptoms as early as 3 days. So, but the good thing is that our public health interventions that we know of with, for instance, wearing a mask is very effective. And especially if everybody's wearing a mask, mm-hmm. I know we don't have a mask mandate on at the time, but masking in public or with people you don't necessarily live with is super important.
Right. And of course, there are some mask mandates right now in parts of Guilford County, and the Guilford County Board of Health is going to meet. Actually, as of this recording, they will be meeting tomorrow. So that could change as well. So talk about masks, though. I've been hearing word that there is a difference between different kinds of masks. I mean, you held up more of what we think of as the surgical mask, the disposable type. This is a cloth mask. Which is better? Is one better?
Yes.
What should we do?
So when I think of the different types of masks, there are cloth masks. They tend to be the less effective type of masks. And in part, it really depends on what kind of material it's made of. And especially if you're washing it frequently, the fibers don't stick together and the filtration isn't great. So if you're using a mask, a cloth mask, the ones with a pocket where you could put a filter in is probably much more effective. Surgical masks like this, they're very good. They're better. They're generally better than a cloth mask. They're thought to be in the 65% filtration. And if you put it on and use the side, these rings and make it tighter around your face and making sure there's a wire. And if it's really well across your face, it brings it up into the 70% effectiveness. So still really good. Mm-hmm. There are also these KN95, and that 95 represents 95% effectiveness of filtration. Okay. So those ones are the thicker ones, and they too, they're probably, if you have access to them, I think those are great.
Okay, so that's some good advice. All right, so cloth is better than nothing. Then the step up is the more disposable type that we think of, the surgical folded type. And then those more rounded ones that you see the KN95 on them or 95 on them are the best that we can get. So that's some really good advice. Let's talk a little bit about testing. So I think there's a lot of confusion about who should get tested and when you should get tested. Can you speak to that a little bit?
Yeah, that is a great question. There is a lot of confusion about that. So there's two types of tests available. The PCR test tends to be the one that's most sensitive, and those are the ones that they can either put a swab in the intranasal area or the deep one where people are like, oh, they're tickling my brain, the nasopharyngeal one. And those are the ones that are often provided at a lot of the community testing sites. And the turnaround time is anywhere from, depending on where you're going, anywhere from 24 hours to even 7 days. Mm-hmm. And if somebody has had COVID before, the recommendation is not to use that one in the last couple months, because the last 90 days, because sometimes the test can still be positive. It's detecting remnants of virus. That doesn't necessarily mean you're still positive. The antigen tests, those are the ones that we're hoping to find more easily over the counter. Sometimes you can look online at different stores that you can get them from. And there's probably some sites, but those are the ones that are considered rapid. The answers come back in 10 to 15 minutes. If somebody's having symptoms, cold-like symptoms, nasal congestion, and especially if you have somebody in your household that has similar symptoms, or you came in close contact with somebody that's had COVID, the probability of you having COVID is pretty high. And so seeking testing on either one of those platforms work. The key thing, though, is that if you're getting tested, there's a high probability you have it. You should be assuming you're positive. Stay home. Stay, isolated. Stay masked around your family members. You're trying not to give it to them. And then I think lay low and to just stay hydrated. If you start having cough and shortness of breath, that's when you should seek medical care.
And so the latest advice from the CDC is that if you, correct me if I'm wrong on this, if you test positive or from the day your symptoms start, you should quarantine and mask for how long?
So technically, the day your symptoms start is considered day 0, and you should isolate for an additional 5 days. And at the end of those 5 days, if you're improved, like just minimally symptomatic, do not have any fever in the last 24 hours, you can go back and resume your work. And the key thing, though, is the caveat to that is masking. You have to mask all the time, not sharing like lunch with folks or having breaks with folks, is really being very super diligent of wearing a mask when you're out in the community.
Okay, so here we go. Back to that mask again. Let's talk for a little bit about vaccinations. Where are we as far as vaccinations in this area right now? About how many people or what percentage are vaccinated and at what ages?
Yeah, so the breakdown, for those who are older than 65, we have really fairly great uptake of the vaccines, greater than 85%. The folks that are less, I think closer to that 50%, are those who are 18 to 45.
Mm-hmm.
And that part is the challenging part, because most people in that age range, they're college students, they work, they have families, and maybe take care of their parents, and so it's this group of the population that does so much, right, for our community, and yet they are probably also the most at risk to getting sick if you're not vaccinated.
Mm-hmm. And spreading it, I would think.
Spreading it.
Because
around. Yeah. And then I will have to probably look at our most recent snapshots of the age breakdowns with younger kids. Mm-hmm. The good thing, though, recently is that the CDC and the FDA approved booster vaccines for those who are 12 and up, which is great news.
Okay, so what are you seeing at the hospital as far as the difference between those who are vaccinated and those who are not? We know that there are lots of breakthrough infections, so even people who are vaccinated are getting COVID, and some are still going to the hospital. But what are you seeing as far as recovery? Is there a difference?
So the predominance that we still have in our hospital amongst our COVID cases is that it's probably anywhere from 70 to 75% are unvaccinated, so still a very high proportion. In the past, we would only have about 5 to 10% of people who were considered breakthrough cases, but now it's closer to 30%. Mm-hmm. But again, that definition of what's fully vaccinated has also, I think, been a little bit confusing. So those who've received a booster are the most protected against getting severely ill or hospitalized, and obviously the highest protection against mortality as well.
Okay, so that vaccination rate is still so very important. As you said, so right now it is cleared for anyone 5 and up can get the vaccine, and anyone 12 and up can get the booster, right? And we're hearing that the hospital is seeing a lot of patients. So what is the toll that this is taking in the hospital right now? I mean, as far as beds and as far as treating other patients with other conditions and scheduled surgeries and things like that.
So, that's an excellent question. And we are no different than our other health systems in our community, as well as what you read on the national news, that all the health systems are being severely taxed by the component of we're seeing the highest numbers of COVID patients than we ever have. And because of that, too, that crowds out, beds that we generally would take care of patients for other reasons. And also, the key component, too, is that a lot of our healthcare teammates are also acquiring COVID from the community. So they are out and unable to work for, an X period amount of time. And so it logistically, it's a bit of a strain. And in order for us to kind of compensate for that or try to figure out how to still provide, great care to patients, we've asked like our elective surgery teams are delaying surgeries so that we can use their staff to help with taking care of patients for medical problems. We are also asking a lot of our outpatient ambulatory sites to make sure that they see a lot of respiratory patients, and make room to, take care of COVID patients in your clinics and do as much as you can too in educating their patients of the importance of masking and testing and vaccination. Mm-hmm. So I think a lot of health systems are under a lot of strain right now, and we are doing as much as we can in order to still provide as much care as we can, but it's taking it's putting a lot of pressure on the system.
Yeah, most definitely. So how does this compare? We hear a lot of people say, yeah, but it's for a lot of people, it's no different than a flu. How does this really compare to a typical flu season as far as what the hospital sees? Are you seeing that many more patients?
Yeah. So, I think that's the part that's you've hit on it on the head. A lot of people say, well, I heard it's not as bad. However, if you are seeing like 10 times, 30 times more cases, the absolute number is still very high. So we are at the highest point of COVID patients that we have in our hospital that we have yet to peak with this Omicron. So we suspect we were still going to see many more cases. And generally, the winter season is when a lot of hospitals are very busy as a whole, treating all other types of illnesses. So it is a challenge, I think, much more so than I think a lot of people anticipated that how quickly it came into the community.
What kind of, we talk about mental health a lot right now with the toll that this is taking on everybody, especially our young people. But what are you seeing in the hospital as far as, the strain on all of everybody working in the hospital, and not just the medical professionals, but those who work behind the scenes also in nutrition and in cleaning and all of those types of things? What kind of strain is it putting on them and their mental health, not just physical health?
Yeah, I wouldn't lie if I don't want to cover up the stress that a lot of healthcare, like any of our teammates, are enduring right now. It is kind of multifactorial, right? It's the stress of maybe at home, people having COVID in their household, or their family members are hospitalized, or the fact that now they are working in an environment that has many more COVID patients, and they too worry that they may be bringing it back to their family. And how vaccines have become like so contentious, and when I think sometimes when some patients come in and maybe they mentioned how they don't feel like, some of the medicines don't work. I think it's very hard. It's been a long haul, and I applaud anybody that works in healthcare right now. I think they're trying to do their best. They really care for patients. They care for their teammates. But this is a very stressful time to be in right now.
Yeah, it is. I think it is for everyone, but especially those in healthcare for sure. Can you talk a little bit about some of the treatments for COVID that Cone Health is using right now, and the availability? We hear about them so much on the news, and I think people think you can just, if you get COVID, you'll just go get these treatments. Is that the case, or what is the truth there?
Yeah. So, if you had asked me that like 3 weeks ago, we're like, or 3 to 4 weeks ago, I would have said, no, we have plenty of ambulatory options for patients on the ambulatory side, on the outpatient side of providing monoclonal antibodies, some antivirals. But because the Omicron variant has made our previous treatments kind of just ineffective, we're not using them anymore. And so the newer drugs, though, that are available, unfortunately, we only have one monoclonal antibody that's available, and that is in very short supply. So we can only really give a third of the volume that we previously did on a given day. We have started to receive some of the antiviral medicines that are pill form, but that too is very limited. And also it has some high side effect profiles. So not everybody would qualify to receive them. So, and we also use another antiviral infusion called remdesivir. That's the medicines that we still use as an inpatient. And so we have some of that as well to use. But again, we have such sheer volume of positive patients and a smaller amount of treatment available. It leads to a lot of frustrations. I think, a lot of patients want treatment. A lot of providers say my patient needs this, and so it's hard. We wish we had as much of these medications to provide to everybody, but we don't.
Yes, and you're looking for that crystal ball or that light at the end of the tunnel, and it's just not there yet, is what it sounds like to me, as far as, having everything you need, as far as having fewer patients. I mean, it sounds like you kind of need both. You need the patient load to go down, the number of cases to go down, and the availability of testing and medications to go up.
That's right, Rosemary. Yeah, we are really anxiously awaiting to hear, how if any of the manufacturers have really scaled up the distribution of medications, and as well as hoping to hear how I think we're making some headrows with increasing access of testing to the community. So a little bit of improvement, but we really do need everybody to realize the seriousness of this pandemic at this time. We need everybody to adopt the safest practices. That includes masking, and those who haven't been vaccinated or haven't received their boosters, this is still the time. This still will work. We need you to get out there and get that done.
Okay, good advice. And I guess I just would like to end with just kind of thinking down the road. I mean, you're thinking about infection prevention all the time. I mean, that's your job, and it's not just limited to COVID. I know that there are other things on your plate. And are you able to look ahead at all, or is the hospital still so consumed with just trying to deal with the now? I mean, are you able to forecast or hope what's any of that? Does that make any sense?
Yeah, it does. We often look at other cities that have either here in the US or in other countries to see how they've fared thus far. And, there are signs that, for instance, I think some parts of New York City are seeing improvement. Some parts of DC have figured out they've peaked, and they are roughly 10 days or 7 days ahead of us. So there are signs. We anticipate that probably the end of February or March, it will look much, much better. We haven't put everything on hold. However, right now, the focus for our health system is really still being able to meet the needs of our community, both for non-COVID reasons as well as COVID reasons. And I know, I think some people worry that, if we've shut down elective surgeries, what does that mean as a whole for surgeries in general? That's we're still doing surgeries for emergent and urgent cases. And I think everybody wants to get back to normal, but we're not quite there yet.
Yeah, we all do. Well, thank you. I really appreciate your time today. And again, reiterate that vaccination, masking, and testing, those are the three things that we can all do to help ourselves and help our community.
That's right.
Dr. Snider, really appreciate your time. Thanks for spending some with us today.
Oh, thank you so much.
Coming up right after this break, we're going to share a little bit more information with you about COVID, where to find all the dashboards, the latest on the mask mandate, and also what's happening in our schools. That's coming up right after this quick break.
Welcome back to Gate City Insider. Well, you probably noticed I am not in the studio anymore. Often we record Gate City Insider over a couple of days to accommodate our guest. This month, we talked with Dr. Snider on January 12th, the day before the Guilford County Board of Public Health was scheduled to discuss a mask mandate for the county. Well, later that day, I learned I had been exposed to COVID. So I find myself recording the second part of our show from my home. Well, on January 13th, the Guilford County Board of Public Health did vote to impose an indoor mask mandate for all of Guilford County. The rule requires people to wear masks indoors at businesses, establishments, and public places around the county. Additionally, the Guilford County Board of Education voted requiring masks in schools through at least February 8th, when they will consider that measure again. And of course, that measure has been in place since Guilford County schools went back in right after the pandemic began in fall of 2020. There is so much to follow as this pandemic drags on, and we really wanted to share some resources with you and some information that might help you make sense of it and make sense for what works best for your family. As Dr. Snider mentioned, conehelp.com is really a great resource for finding COVID vaccination information and also scheduling those all-important COVID tests. So you can do that right from conehelp.com. You can find those locations. HealthyGuilford.com is updated daily with the latest COVID stats for our county and for our state. It has a ton of information. You can also find locations for getting a vaccine there and also testing locations. So be sure to check that out. Again, that is HealthyGuilford.com. You can be ready for a COVID exposure by ordering free COVID tests now available at covidtest.gov. Now, every household can order 4 tests to be delivered later this month. Again, that is covidtest.gov. I've already done it. It was quick and simple, easy to do. If you don't have access to a computer to do that, as far as ordering, you can also call, and the number is 1-800-232-0233. Okay, if you have children in Guilford County schools and they are exposed or test positive for COVID, you can refer to the Strong Schools NC Public Health Toolkit, which was updated on January the 10th. With new guidance on when and how your child can return to school. Because I find that that's a lot of people have questions about, when can my child go back? What do they need to go back? How long do they have to wait before going back if they're exposed or if they test positive? Every scenario you can think of is listed there. And really the easiest way to find this toolkit is by Googling Strong Schools NC, and make sure you look for the toolkit that was updated on January the 10th. That has the latest guidance on all of that. Well, the advice that we've been hearing, of course, for preventing the spread of COVID from scientists, from health leaders, from hospitals, for really the past year remains the same. And that includes vaccinations, masking, and testing. And those are the 3 things that we can the takeaways that we hear over and over. This pandemic has affected us all. It has affected our health, physical, mental, emotional. It has affected our finances. It is affecting and has affected our relationships. And it's going to continue to impact us, even when the masks are all a thing of the past. Please be sure to be kind to each other. Stay safe. We are all doing the very best we can in a very, very difficult situation. Thank you for spending a little time with us, some of your time with us today. We really appreciate it. And we will see you next time.